One of the biggest mistakes you make has nothing to do with taking the wrong medication. It has nothing to do with missing appointments. It has nothing to do with ignoring symptoms. The mistake happens long before any of that. It's looking at one abnormal lab result and assuming you already know what it means. And that mistake costs you your health every single day. And it's not because you're not smart or you don't care. It's because our healthcare system gives you data without giving you understanding. So let's think about your last set of blood work. Maybe one number had an asterisk beside it, or it was highlighted in red, or labeled high or low. And within seconds, your mind started racing like, is something wrong? Or do I have cancer? Did my kidney function get worse? Should I go to the emergency room? Why hasn't my doctor called me? So you immediately jump to conclusions because that's exactly what the healthcare system unintentionally trains us to do. And today we're going to change that because the biggest mistake isn't the abnormal number, it's you believing one number tells the whole story. And I've lived this more times than I can count. And as someone living with lupus nephritis, chronic kidney disease, end stage renal disease, years of dialysis, a kidney transplant, acute rejection, chronic antibody mediated rejection. I've had thousands of lab values collected over the years, and I've opened patient portals and watched the results appear before anyone called me. I've stared at the red numbers and the abnormal values, and I've watched my creatinine rise. I've watched my hemoglobin fall, and every abnormal number brought questions. Fear in some cases, fear in some cases, and sometimes confusion and even frustration. But what I eventually learned changed the way I looked at healthcare forever because a lab result is not a diagnosis. It's only one piece of evidence. That's all. It's a clue. It's one chapter, and it's not the whole book. And when it comes to abnormal lab results, a lot of you think that it's terribly wrong, and it doesn't. And so this example that I'm going to use is about creatinine. So let's just say your creatinine is slightly elevated. Does that automatically mean your kidneys are failing? No, not even close. And usually if your creatinine is elevated, your doctor will more than likely ask questions like, were you dehydrated? Did you recently exercise? Have you been eating differently or did you start a new medication? And they'll more than likely look at your previous creatinine values. And that type of data matters because remember, lab medicine is about patterns and you focus on the numbers, but clinicians focus on the trends. And that's a very important decision. And every lab result has a story, and that story includes your age, medications or diagnoses, your medical history, your previous results, your symptoms, why the test was ordered, why you're fasting, whether you're sick, whether you recently had surgery. And without that context, those numbers become almost meaningless. And so just think about reading one sentence from the middle of a novel. You wouldn't understand the story. And lab results work the same way. And so you make the same decision, right? When it comes to Dr. Google. Uh, Dr. Google, or you Google the abnormal value, and Dr. Google isn't designed to understand you. Dr. Google is designed to answer questions generally. So let's say you go ahead and go to Dr. Google and you type high creatinine. And immediately, some of the results are kidney failure, dialysis, dehydration, medication, medical injury, pregnancy, rare diseases, benign explanations, life threatening conditions, just everything. Because Dr. Google gives possibilities, it does not give probability. And your healthcare team thinks in probabilities. And that's a very different way of approaching medicine. Okay. So let's just discuss questions that you should ask instead. All right. So instead of asking, what does this number mean? Ask, what does this number mean for me? Because that changes everything. Because you're asking about context, you're asking about your health and your medication and your history, your trend. And that's where real understanding begins. And this is exactly why I built Alvora Health. It's not to diagnose disease, and it's not to replace physicians, and it's not to tell people that they have something that they don't. I built it because you deserve explanations, and you deserve context, you deserve simple terms, and you deserve a place where you can upload a lab result and ask, what am I looking at? Or what questions should I ask? Or has this changed? Or what trends should I discuss? Healthcare should not begin with confusion. It should begin with understanding. All right. One question can completely change your appointment. 5 questions can change your healthcare journey. Whenever you receive an abnormal lab result, ask, how does this compare to my previous result? One number rarely tells the story. Trends often do. Remember, patterns matter. Number 2, what could be causing this result? There are usually multiple possibilities, and understanding them reduces unnecessary fear. And number 3, does this change my treatment plan? Now, not every abnormal result requires action. Knowing whether you care changes, knowing whether your care changes provides clarity. Number 4, should we repeat this test? Now, sometimes the next step isn't treatment, it's confirmation. And then number 5, what symptoms should I watch for before my next appointment? Now, this question helps you know when to monitor and when to seek care sooner. And these 5 questions shift you from reacting to participating in your care. Now, your lab result is not trying to scare you, it's trying to inform you. And the problem is that information without context often creates anxiety instead of understanding. Because one abnormal number is not your diagnosis, it's not your future, it's the beginning of a conversation. So become curious and ask questions. Look for trends and seek understanding before drawing conclusions. Because healthcare becomes much less frightening when you understand the story your body is telling. So if you ever looked at your lab results and wonder, what am I looking at? I've created something for you. Download my free guide, The 5 Questions You Should Always Ask Your Doctor, using the link in the description below. And these 5 questions have helped me navigate years of chronic illness, dialysis, transplantation, and ongoing medical care. And they'll help you walk into your next appointment feeling prepared, confident, and ready to have a meaningful conversation with your healthcare team. And if this video helps you see your lab results differently, subscribe to Let Care Speak. And This is where we turn healthcare confusion into healthcare clarity because better clarity leads to better understanding.